Hi, everyone. Welcome to Question Period Rewind. I'm Donna Skelly, Speaker of the Legislative Assembly of Ontario. 1986, what a year. In Toronto, a TTC ride was 45 cents for kids and $1 for adults. Over at Honest Ed's, you could get a pair of pantyhose for 77 cents. And the population of Ontario was about 9 million people. Now, let's see what the hot topics were for the province at that time.
Order. Oral questions. The Leader of the Opposition.
We not only can't trust you with patience, we can't trust you with telephones. And anyway, your leader doesn't know how to use one.
Question.
That's right.
May I, Mr. Speaker, we have a series of very crucial questions for the Premier, and we were notified that he would, in fact, be in the House at 2:35. I wonder if there's some information from the government.
To be here approximately 3 o'clock. He is presiding at the opening of the Margaret Birch wing of the Scarborough Hospital.
Is it?
We'll never be back.
Order. Question.
It's nice of Margaret to have it.
Order.
He's all alone.
That's right.
Order. Leader of the Opposition, first question.
The Mount Sinai canceled the opening. Mr. Peterson was supposed to attend yesterday because they knew his presence
Question,
would cause
please.
a great deal of difficulty. I have a question in the absence of the Premier of Ontario on this crucial day for the healthcare system. And I will ask that question to the Minister of Health in the Premier's absence. The Minister has told us day after day that basically all we're seeing in the system is inconvenience. And he's also assured us that he is looking after matters as best he can. I want to raise with the Minister, therefore, this afternoon, a case that concerns a constituent of the member for Perth, the Speaker. The father of a 20-year-old woman in Listowel is desperately today trying to save his daughter's life. She is in hospital suffering from anorexia nervosa. She has dropped from 150 pounds to 82 pounds. She's had nothing to eat and only juice to drink for the last 16 days. Her doctor is quite concerned that she may collapse without proper psychiatric and medical treatment. That treatment's not available at the Listowel Memorial Hospital, where you yourself attended a short time ago. The doctor has been trying to get the young woman into a major medical center, such as University Hospital in London or Toronto General Hospital, for several months. The family has been told for 2 months that they must wait for space to be available in one of the treatment programs. Now that the strike is on, however, Minister, the doctor reports that the possibility of obtaining this treatment is non-existent.
Question, please.
This young woman is not going to get treatment.
Question.
Mr. Speaker, your constituent phoned our office this morning because he has in fact called you on 5 occasions asking for help. The member for Perth has diligently and loyally tried to serve his constituent by speaking to the Minister of Health and taking this case up with him. The caller called back this morning to say that despite all the calls to the Minister of Health by their member, the Speaker, nothing has come of it. And the member for Perth has had to say there's nothing the Minister of Health can do about it.
Order.
Could you tell us?
Order. Minister.
Well, Mr. Speaker, I cannot comment on why the physician was unable to get help over several months. I don't know which people have refused to see the girl over those several months. I certainly will look into why people have refused to treat her or have obviously refused to see her. I cannot comment on medical decisions that have been made by other people. We know that the system is under the care of the physicians. I know that general practitioner must surely have been trying his very best over this last several months to get that help. I cannot explain why it is that people have not been able to reply to his request for help. I will look into the matter much further and report back to the Honourable Leader of the Opposition.
Supplementary.
So I want to remind the Minister that he is ultimately responsible for the care and safety of the healthcare system by legislation. And I say to the Minister that this case has been raised with the Minister by the member for Perth on 4 or 5 occasions. The member for Perth ultimately called back his constituent on 4 or 5 occasions. If this isn't important enough for your party, then stand up and say so.
Order. Supplementary. Question.
The Minister, by way of supplementary, my question to the Minister is this. After having assured this House that you are looking into all cases raised by members of this House and finding out what's wrong with it, what can be done, could you explain why the member for Perth now has raised this case with you in your office on 4 or 5 occasions, and this afternoon you only now promise to look into it?
Mr. Speaker, the honourable gentleman is not providing all the details. It's very difficult when there are no names attached, obviously. We have, at least in one case, if you would provide me with the name, then I'd be able to check on the information. The difficulty is with somebody standing up describing those details without names and dates and places. How can I comment without risking being inaccurate? The difficulty is, in one particular case, and I'm not sure that this is the one, we were in touch with 2 or 3 people in that town. I presume it's the same one, and we advised that there should be, in that one case, a visit to a hospital facility where there is, in fact, the emergency department. Several weeks ago, an emergency department of a hospital that did have an anorexia facility on site. We advised. I'm not sure that that's the right case. I just have to know the details. I'm sorry, I have to know the details so that I can respond in a reasonable way with a degree of certainty about the facts. That's the best that I can do without enough information to really be confident of the information I'm providing is right. That I will tender as the information that I can make available to you at this point, guessing about the details.
Final supplementary.
Well, Minister, the family has indicated that we can make all the information available because they are so desperate. But I want to emphasize to you, the question is not whether you have an answer to this afternoon without names. The question that I'm posing to you is this: how can you have assured the public of this province through this House that cases raised with you will be resolved by you and you'll look after them so they shouldn't worry, when the member for Perth has been trying to help this desperate situation for several weeks, and you this afternoon don't...
Order. Minister.
Mr. Speaker, I've told the gentleman opposite that, in fact, I can only respond with a degree of certainty when I've given the details of the case. He's provided a very, very minimum set of facts, and I don't like to guess. I have even done that in my answer to the second part of his question. But I can tell the honourable gentleman that we did suggest a means of responding to the need. In that one case, it was not, I guess, acted upon. But I can tell the honourable gentleman that he is not right. We do take our activities extremely seriously, but when he stands in the House and does not provide the details, I cannot answer with a degree of accuracy. I can tell the honourable gentleman that one thing that he would like, I'm sure, to help us do is to move forward with the development in the healthcare field, and I'm sure he would like to help us pass the bill as quickly as possible.
New question, the Leader of the Opposition.
The member for Perth has to desperately report to his constituent that the Minister of Health can do nothing to help this seriously sick young woman, and you're watching...
Order. Would the honourable member take seat? Order. Order. Do you have a new question?
Mr. Speaker, we have a second question for the Premier of Ontario. We would stand it down until he arrives, or, well, we'll see what happens if he doesn't.
I'll have to ask the House. Is the House agreeable to stand down the question? Agreed. First question, the member for York South.
Speaker, I have a question in the absence of the Premier, a question for the Minister of Health. I'm sure the Minister will know that the House spent 13 days on second reading of this bill. We spent 19 days in committee, and we have now spent 10 days in Committee of the Whole, including today. I'd like to ask the Minister, would he not agree with me that what we need, first of all, is back-to-work legislation as far as the Tory opposition is concerned, as far as this legislature is concerned. What we need is to get Bill 94 through, and can the Minister tell us what steps he intends to take to see that Bill 94 is passed by this legislature so that a clear signal can be sent to the OMA with respect to our position on extra billing?
Mr. Speaker, I agree that I would like to see the bill moving somewhat more quickly than it is. We spend full afternoons to do one section at a time. I cannot control the activities, of course, of the official opposition. I'm not sure that there is any ability to control the membership over there. That's a concern that must, I think, from the public at large, be expressed, that there is no control in that, in the manner in which this bill is being currently debated. I would like to see it moving along much quicker. I would like to see this afternoon's debate proceed and assess at that time what is required.
Supplementary.
Mr. Speaker, there is a strike on in this province which is seriously affecting the ability of the citizens of this province to get access to health care. At the same time as that strike is going on, we have had a systematic filibuster, a holding up of legislation which expresses the view of this legislature and the people of this province with respect to extra billing. I think we are now entitled to ask the Minister, as a spokesman for the government, what do you intend to do? What steps do you intend to take to see that this debate, this filibuster, is brought to a conclusion, that the bill is voted on, and that clear message from this legislature with respect to the end of extra billing is sent to the OMA so there can be no illusions as to what the majority view of this legislature is and what the majority view of the public of Ontario is with respect to the practice of extra billing in the province of Ontario.
Well, Mr. Speaker, I think that there is no misunderstanding in the public about what the view of the majority of this Legislative Assembly is with respect to this bill. In fact, they know that this bill is going to pass. We know that the majority of the Legislative Assembly of this province has committed to ensuring that extra billing in this province ends, and it will be brought to an end. We will process the bill. We will debate the bill. I'm in a position, again, to call for extra sittings this evening, if that is required, to complete our clause by clause, and I'm prepared to sit here all evening if that is appropriate to finish this bill.
Final supplementary.
Mr. Speaker, we're happy to sit. I've indicated earlier on, we're happy to sit as long as it takes to get this legislation through, and we challenge the Tory party today to stay in this House until such time as this legislation is through and until such time as Bill 94 is passed. That's the challenge that we issue to the Tories. They're the ones that are sending the wrong message out to those physicians and those strikers who are denying the patients of this province the health care that they deserve. It's the Tory party that's doing that.
Question.
Speaker, what I want to ask by way of final supplementary, in the event that the Tory party indicates that it is not prepared to sit and it is not prepared to deal with this legislation and not prepared to get it through, is the Minister prepared to recommend to his cabinet colleagues that we allocate time in this legislature in order to bring the debate on Bill 94 to a conclusion?
Mr. Speaker, I think that at this stage we have debated this bill at length. I know that the public has seen us debating and making sure that we can come up with the best bill that is possible. I can tell the honourable gentleman that my opinion is that we take extra time if that is required this afternoon to sit and deal with the clause by clause. I'm prepared to do that, and I think the members here ought to be prepared to take those steps to ensure that the Bill 94 is passed. I think with that in mind, I think that we will look to see progress this afternoon, and I will assess the situation later in the afternoon.
New question, the member for York South.
Speaker, new question to the same minister. I'd like to ask the minister, does he consider that he, as minister, is responsible for ensuring access of patients to the healthcare system, or does he regard that as the sole prerogative of the College of Physicians and Surgeons?
Minister?
Mr. Speaker, I think the honourable gentleman will know that in terms of access that there are a number of people who have worked together to ensure that there is access, and we have worked in the past and will continue to work at ensuring access to the healthcare system on the part of the patients of the province.
Supplementary?
Mr. Speaker, the minister has not answered the question. I'd like to ask the minister by way of supplementary. By way of supplementary, Mr. Speaker, I'd like to ask the minister. He will be aware of a number of statements today in the press by members of the College of Physicians and Surgeons indicating that they agree with the actions of the OMA, that they support the strike action by doctors, and that they do not agree with the steps that were taken in 1982. People will be aware of those statements by members of the College of Physicians and Surgeons. I'd like to ask the minister, given that clear endorsation of strike activity and the denial of access to health care by members of the college, who are supposed to be responsible for disciplining the profession who deprive patients of health care, just what do you intend to do about that?
Minister?
Mr. Speaker, I'm afraid that I will have to answer that question in the past tense because I have already done something about it. I have been in touch with the college. I have found out, for instance, that the registrar, to whom some quotations were attributed, has received an apology from the reporter indicating that they had not correctly attributed the quotations. I do know that the college is concerned about quotations that are attributed to another member or other two members of the college, and I can tell you that they are looking at that very question this afternoon in their extraordinary meeting.
Final supplementary.
Mr. Speaker, Dr. Shelley McLean, who is president of the medical staff at the Ajax Pickering Hospital, was on television last night. And I'm sure the minister will be aware that Dr. McLean said in a report under the CBC National report by reporter Claude Adams, said, and I quote, "If one patient dies now, we may be preventing 100 patients dying in 5 years because of lack of access to health care." I'd like to ask the minister, have you referred Dr. McLean's outrageous and thoroughly unprofessional comments to the College of Physicians and Surgeons? And if not, why not?
Minister?
First of all, Mr. Speaker, the only reason that that matter was not brought up in my discussions earlier was that I had not, with the college, was in fact that I did not know the name of the physician. I had heard only about the reports. I can tell the member in a position to do much media gazing or watching these last few days. But I can tell the honourable gentleman that I find his description of that particular statement to be an accurate one, and I will intend to refer that matter to the college. I don't think that there is any physician in this province who would seriously follow what you have reported as a quotation there as being part of their training. I can tell you that the people, even those people who are in emergency rooms that are on restricted service, are assessing people as they come in the door. They are delivering medical decisions, rendering judgments, and in my opinion, that statement is not indicative of the medical profession in this province.
New question. The member for Cochrane South.
Thank you, Mr. Speaker. I have a question. You're with them, so don't worry about it.
Question.
Mr. Speaker, my question is to the Minister of Health, and it's based on. Ask your leader. Mr. Speaker, my questions to the Minister of Health, arising out of a question I raised with him yesterday and a conversation that we had after question period. Could the Minister in detail explain to me and to the people of this province what monitoring is going on and what medical assessments are going on with respect to referral patients to Toronto, whether or not to be from Listowel or from Northern Ontario?
Minister?
Mr. Speaker, the honourable gentleman asked the question, I guess, yesterday in the House to the Premier. I can tell the honourable gentleman that we did yesterday have a concern expressed about those referral patients who were unable to either get information from any of their physicians. I think in the situation, we would advise that when people do have concerns about whether the referral should be the referral from Northern Ontario or any other facility to another physician was in question, that they contact our hotline so that, in fact, we can make some further inquiries on their behalf. I can tell the honourable gentleman that, as I did yesterday in our conversation with him, expressed a concern that there was difficulty in finding out for the patients information when the patient's physicians were not able to provide those answers. I will tell the honourable gentleman that that concern is still one of mine, and I think that first and foremost the patients must make extraordinary efforts probably to get their own general practitioner or from whomever they have been referred to give that information to them about the success of a referral as to whether somebody is working or is not working.
Supplementary?
Mr. Speaker, through you to the Minister of Health. Mr. Minister has a responsibility under law to the people of this province for delivery of health care. The fact of the matter is, when you call the ministry hotline, as our party did over the last 2 days, you're told to get in touch with the emergency department of a local hospital. The people who are being referred to the Toronto hospitals have nowhere to call to get an answer. You are the one that said 2 nights ago that the situation is in hand. And Dr. Railton said the situation was in hand. There is only minor inconvenience. That is not true. There is no control. There is no medical assessments. There is no monitoring going on about referral patients from other parts of the province to Toronto hospitals. How can you still claim that the situation's in control?
Minister?
Mr. Speaker, in the situations where there is a concern expressed like that, I think that the proper advice, particularly if people are being referred for surgeries and they cannot reach their family physician, that in fact a good piece of advice is to go to emergency facility if it's in an emergent or critical nature. No, if it's in your hometown, for instance, what about going to that one? Because you may find that the family physician in fact is on duty in that emergency room. I can tell the honourable gentleman that the concern that he raised with me yesterday after question period is a real one for me, because in that situation I think that there have to be extra steps taken to contact those family physicians or the specialist to whom the person may have been referred. I think that is, in this case, the best piece of advice, but if there is a medical assessment required, obviously then people are going to have to report or at least contact the emergency rooms to find out if in fact there is a further assessment that can be made there. I can tell the honourable gentleman, however, that I still have concerns when it is difficult to reach those physicians, but physicians, generally speaking, are available to make those medical assessments.
New question, the member for Hamilton Mountain.
Thank you, Mr. Speaker. I have a question for the Minister of Energy. The Minister is aware that since the government was formed last June, that $1.9 billion additional dollars have either been spent or committed on the Darlington Nuclear Power Project. Each day that passes means millions of dollars in terms of Darlington. The Minister promised in April a statement very soon on the Darlington question. Can the Minister confirm for this House that the government has made its decision on the future of Darlington, and can he explain why that position has not been put in the House as he promised?
Minister?
Mr. Speaker, I think it's been made very plain that this government has not, in fact, made a decision on the completion of Darlington. The fact of the matter is that you should know above anyone else that this government, reconstituted the Select Committee on Hydro, which had been disbanded by the former government when they formed the majority. So we are, in fact, placing a very high priority on that committee. We certainly have not made such a decision, and that decision will be shared here in the House before it is shared anywhere else.
Supplementary?
Supplementary, Mr. Speaker. The Minister referred to the Select Committee, and the Minister should realize the kinds of problems that he's causing for the Select Committee. The Select Committee made its interim report last December. The government has not responded to that interim report yet. The Liberal members on the committee are unsure and divided to the extent where one of the Liberal members has withdrawn from the committee over the Darlington question. The Select Committee requires your response. When will you respond, at very least, to the interim report of the Select Committee of December?
Minister?
Good question.
Mr. Speaker, it's obvious that there were many other things that transpired since the first report from the Select Committee. There are other initiatives that this government is looking very diligently at that have to do with conservation, with the excellence and the use of power in an economical way, load management, cogeneration, small hydraulic. We have a plan that we're going to go forward with that will guarantee the people of Ontario a demand-supply situation that's going to meet the requirements of the residents and the manufacturing base, which happens to be the heart of this whole process in Ontario. That's the program this government has. It will be done in a most responsible way, and the decision as to whether we should finish Darlington will be made in this forum. Thank you very much, Mr. Speaker.
New question? New question? Leader of the Opposition?
Mr. Speaker, we're in a conundrum here because the Premier's driver has been seen in the environs. His press aide is here, and we are told that the Premier himself has been in the building for 5 minutes. I wonder if
Order. The House agreed to stand down the second question until the Premier arrived. Maybe we could go on with another question.
Well, hearing.
New question, the member for High Park, Swansea.
Mr. Speaker, my question is to the Minister of Citizenship and Culture. The minister claimed. The minister claimed.
There, she's coming there. She's just.
I see the minister is going to her seat.
Order. Order. The member for High Park, Swansea.
The minister claimed on April the 25th that her government was committed to multiculturalism and that it was a priority with her ministry and that she had an excellent working relationship with the chairman of the Advisory Council on Multiculturalism. I don't want to accuse the minister of misleading this House, but can she explain why she slashed the budget of that council from $323,000 last year to $252,000, which is less than the budget of 2 years ago, refusing to increase that budget, why she failed to reappoint half of the council members, paralyzing the council so that the chairman of that council, Mr. Frolick, has sent 2 memos saying the following on June 6th.
Order. The question's been asked. Now you're making further comments on your question.
Mr. Speaker, I had to get up and sit down. The minister was not in her seat. Can I complete my question with your permission, please? Please, can I complete my question? I'm just completing my question. Mr. Speaker, I seem to have problems.
Order. I appreciate the help of everyone, but I've heard the question. Minister.
Thank you very much, Mr. Speaker. The reduction in the budget between last year and this year is occasioned by the fact that the previous chairman was on a paid salary of a full-term salary of, I think, $70,000. Mr. Frolick is on a different arrangement. We have currently been taking a look at his work plan and are in constant contact with him to indicate the basis on which he's asking for additional assistance, secretarial research or otherwise. In regard to your concern about the appointments to the Ontario Advisory Multicultural Council, we have been getting in representatives from various regions and from various multicultural groups, and those appointments are now being considered.
Supplementary.
Mr. Speaker, the President is saying that they are going to resign as an entire council. There's a crisis in that council. How come she found $570,000 to build a garage for the Botanical Gardens, $70,000 of that council's budget to redecorate the DM's office, and I'd like to know what her priorities are. If a garage and a decor in her deputy minister's office is more important, she should resign, and her sidekick from Parkdale as well.
Minister.
Mr. Speaker, I believe that that our ministry is treating our requests of Mr. Froelich in a sensitive way. We've asked for our work plan. He's now given it to us after the estimates went in, after the estimates for this year. Any of your other comments relating to the Botanical Garden or the garages or resignations are clearly not connected to anything, at least I'm able to see right now. We're on ongoing dialogue with Mr. Froelich. His advisory council are most supportive. I'm having ongoing think tanks with various members of the multicultural group at the moment. They turn up. I can't see the kind of antagonism that you're talking about, but I'm very, very much supportive of your concerns. I don't know what the paper is that you're holding up, but why don't you send it over?
I will replace them. The Leader of the Opposition, second question.
Thank you. Mr. Speaker, I have a question for the Premier. Premier, my question is this. The OMA, just a couple of minutes ago, has indicated the resolution of their council meeting. And the first resolution indicates that the President of the OMA is authorized to escalate at his discretion the sanctions being carried out in protest of Bill 94. And it goes on to say that the medical profession, item 3, the medical profession will continue to withdraw their services if Bill 94 is passed in order to tell the government and the public that the OMA will not work under conditions of tyranny. So my question to the Premier is this. Given this clear indication by the OMA this afternoon that this already difficult situation is likely to escalate into a dangerous situation if we aren't already there now, might I ask the Premier, wouldn't you agree that there is nothing to be gained, nothing to be lost, and much to be gained, particularly in view of the thousands of patients who are being more than inconvenienced, simply today to call a halt for a short period of time and bring in a mediator?
Premier.
Mr. Speaker, first of all, may I apologize to the honourable member opposite and my colleagues. I was at the opening of the Margaret Birch Wing of the Centenary Hospital in Scarborough, and where we honoured one of our former colleagues, and I must say it was a glorious occasion in the honour of Margaret Birch. Mr. Speaker, with respect, I wasn't aware of the resolution passed by the OMA today, just a minute or so ago. But I think this government has set its course very clearly. You see, we believe, and I don't believe it's tyranny at all. You see, the federal Conservative government, federal NDP government, federal Liberal government all agreed some 2 or 3 years ago that extra billing was going to go. We are complying with the Canada Health Act in that regard. The other provinces, so I don't see it in those same terms of tyranny. I think that we have gone on for almost a year now discussing this thing in a variety of ways. It's been in this House now, how long? 3 weeks at least. My own view is the most constructive thing we could all do, including you, is to pass that bill and not drag it out unnecessarily.
Supplementary.
Absolutely nothing.
My question to the Premier is this. Several months ago, the OMA warned you that there would be job action, and you again presumed there wouldn't be. As you got closer to getting this bill passed, the OMA warned you that there'd be a closure of emergency wards. You didn't believe them. And we have a closure of emergency wards. You now have been cautioned by the OMA that should Bill 94 be pushed through, they are going to escalate, not stop the job action. You continue not to believe them. My question to the Premier, we solved the strike in 82.
Order. Question.
My question to the Premier is this. There have so far, in 38 hospitals we've checked, been 3,295 elective surgical procedures canceled. Surely it is now the time for all of us, for you, the leader of the third party, our party, the Ontario Medical Association, to back off for a period of time. Surely it is time for everyone to back off a bit. No one loses face, no one gains or loses any political points here. Surely it would be appropriate now.
The question's been asked.
Surely it
Order.
The question with respect.
Order. Premier.
Chair. This first and second question is the same as his first, and I don't think there's any evidence to suggest that if there's a hold up on this situation, it'll be any different 3 months from now or any other time. You see, there's a principle at stake here, and I think you've seen the majority of the will of the House here. I think it's quite obvious where the majority is. Obviously, in a democratically elected legislature, we all have certain rights. So you have the rights to express your point of view. Your party does, and you are doing that. But you see, I think we all understand what's happening here, and the government and the NDP are committed to passing this bill. It's been going on almost a year now. There's been thorough discussion. We've spent an awful lot of time ringing bells in this House for an hour at a time for minor votes. We've seen, when we're supposed to be discussing the legislation, we've seen history lessons on the College of Physicians and Surgeons, really not discussion focused on the bill. And it is our view, and I think the will of the majority, the view of the majority of this members of this House, although I cannot speak for the third party, that we should be proceeding on this matter, and we're prepared to do so. And we think that would go some long way. You see, sometimes in life you just can't postpone these problems, and you can't postpone it to next week or next month or whatever. And that's why we are proceeding the basis we are, and we're going to keep the lines of communication open with the college of, with the OMA on any subject they want to talk about. But we are moving on the question of extra billing.
Final supplementary.
I want to say to the Premier, I believe he should abandon his determination to get 94 passed, and I accept the fact he is not today going to do that. But I want to say to him that there are thousands of patients who are not any longer being inconvenienced. Their health care is being endangered by this bill. And whether you believe might is right or not, whether you believe putting in a mediator would be bending to the breeze or not, all the patients, all the parents, all the young children, all the cancer patients want today is their doctors back at work tomorrow. Those patients want this question asked to you. The question is simple. Could you please put in a mediator to solve this problem and get their doctors back to work? Premier, they don't want a game of brinksmanship. They don't want a game of chicken played between you and the OMA.
Premier,
they want their doctors back to work.
Order.
Could you do that?
Order. Premier.
A very simple answer to my friend opposite is you can't mediate the Canada Health Act. It's that simple. Either you're for or against it. And look, we have many discussions have gone on over a long period of time, formal meetings and everywhere else. You know we are. I can assure you that we are prepared to sit down with the profession to discuss any issue they want to talk about, because there are problems we have to address. But I say to you, if you're asking me to back off on moving this bill forward, the answer is no. And I repeat to you again, if you think things are so serious, why wouldn't you assist? You just admitted that the bill was going to go through. Why delay it? why delay more than you have already? Why wouldn't you assume now your responsibilities, having just admitted in this House the bill's going to go forward? You have some responsibilities as a legislative.
New question? Order. New question, the member for Ottawa Centre.
Thank you very much, Mr. Speaker. My question is for the minister responsible for women's issues. The minister must be aware
Order. Please show a little respect for other members who are... I'd say that to all members. Order. New question, the member for Ottawa Centre.
Thank you, Mr. Speaker. My question is for the minister responsible for women's issues. The minister must be aware that women who've run the procedural gamut and been booked for abortions at Scarborough Centenary Hospital are having their appointments postponed, some cancelled, and that yesterday one woman who went to the hospital for her appointment was told right then and there that it wasn't on. Isn't the minister glad that doctors at the Scott and Morgentaler Clinic are prepared to help women who are desperately looking for help right now?
Minister?
I don't see any question there, Mr. Speaker.
Mr. Speaker, the minister responsible for women's issues doesn't seem to care what happens to women in these circumstances. And I'll ask him, isn't it the height of cynicism for this government to rely now to depend on the services performed at the Morgentaler and Scott clinics, and then turn around at a later date and perhaps raid those clinics, perhaps charge people at those clinics?
Minister, the record will show that while a comment has been made, no question has been asked of me. What is the question?
New question? The member for Brantford.
How do you like it, Eli?
What arrogance.
Thank you, Mr. Speaker.
Where are you now, Eli?
I think
Order.
Thank you, Mr. Speaker. I think the Attorney General should get his hearing checked, but I have a question for the Premier. The question is this, Mr. Premier: 13 days have now passed since I asked you to table the documentation surrounding the rather unusual award of a grant to the Exploricom project. You have said publicly you're happy for us to have access to any information, but with repeated checks to the Ministry of Industry and Trade this morning, we were told, and I quote, nobody knows what we're supposed to show you, unquote, and nobody knows who's supposed to be getting this together, unquote. Now, my question to the Premier is, if you're so happy to share this information with the House, where is it?
Premier?
Mr. Speaker, the answer is it's in the Ministry of Industry, Trade and Technology. That's where, and I've asked them to gather it up. You put a question on the order paper, and you're welcome to it. No problem. It's all being gathered up. I asked my staff to gather it up. I can't tell you the specific name of the person then, but just keep phoning, because they're enjoying your phone calls over there to all over the place. We're hearing from you quite regularly, and we hear you're turning up blind alleys and cul-de-sacs everywhere you turn. But keep finding, keep searching. We're very happy to give it to you. No problem. It's a marvelous project. We're gathering it up. We'll get it in due course.
No supplementary, Mr. Speaker. Nobody is leaving this cloud over your government but yourself. Nobody is leaving it over there but yourself. You are making public statements that you want to share this information, and it would appear that you're stonewalling and trying to wait out till the House adjourns. Now, I say again to the Premier, will you give clear and unequivocal instructions to the staff of the Minister of Industry and Trade to table that information in the House today or tomorrow?
Premier?
I told you we table it when we're ready. Good Lord, there's a procedure for having your questions on the order paper, as you know. Well, you guys, there's a lot of questions on the order paper. We're answering them all. Look, you know, there's one question on the order paper about the postal charges for bulk mail. I mean, that's the quality of the questions you're asking on the order paper. It's all being gathered up, and you'll get it. I mean, you can ask me every single day, but you see, my friend opposite, who demonstrates his immaturity on many occasions, is again going to find that there's nothing.
Order. I can't hear a thing. Would the Premier take a seat? Order. Order, I can't hear a thing. Order. New question, the member for Nipissing.
Order.
Point of order.
Mr. Speaker, the Premier indicated there's an order paper question procedure. We've got 65 order paper questions that you refuse to follow the procedure and answer. They're over 2 weeks old. That won't wash.
Order. Order. New question, the member for Hamilton West.
Mr. Speaker, I have a question for the Minister of Education. Mr. Speaker, over 1,400,000 adults in Ontario cannot read road maps or street signs, cannot read the directions on their medicine prescriptions, cannot read telephone books, cannot fill out job applications, and so on. Rumors abound in the literacy network of this province that the literacy leadership in your government is being transferred to the Ministry of Citizenship and Culture. Doesn't the minister agree that that would give the mistaken impression that this is a problem essentially of immigrants, ethnic groups, and the like, and is not an education problem as such, which it is, given the high dropout rates, the low streaming of so many of the children of low-income families and so on, and given the inattention to general-level student programs? Is it true, Mr. Minister, that you are abandoning the leadership in this question and running away from the issue?
Minister.
Mr. Speaker, might I respond to the honourable member by saying that certainly in education we accept our responsibility in this very important area. The government has made it clear in its recent speech from the throne that new efforts and new energies are going to be applied in the area of literacy, which is a concern shared by all honourable members. My colleagues in Cabinet are now working to give a specific form to some of this new effort, and I don't think the honourable member will have to wait long to see the fruits of that labour.
Supplementary.
Mr. Speaker, I trust we won't have to wait long, and the movement is going to have to be pretty great, because the government of which that minister is a member at this date spends only $5 per functionally illiterate adult in the province, and his own minister only spends $1.40 per functionally literate adult. Mr. Minister, why don't you seize the leadership in this particular question? Get some vision into your ministry and have it attack this problem in a very significant and aggressive fashion.
Minister.
Well, Mr. Speaker, I have found in this minority parliament that sometimes my leadership is not as favorably responded to by my colleagues in the third party. I can think of a couple of it. But Mr. Speaker, let me say that Mr. Speaker, I like to think that I have demonstrated leadership where leadership is required. We have said as a government that the area of literacy is a matter of real concern. More has to be done. Education will certainly discharge its responsibility, but my colleagues in citizenship and culture in colleges and universities and other ministries of this government do have important mandates that they will continue to discharge as well, and I invite my honourable friend who brings a keen and sensitive understanding to this and so many other areas of education to stand by and to await the results of some of the internal work that we are doing.
New question. The member for Sudbury.
Speaker, a question for the Minister of Housing. The Minister will recall that last week I pointed out to you that 40% of those tenants living in apartments where you have what we call chronically depressed rents, you have a report in your ministry that says that these people cannot afford to pay more in rent. As a matter of fact, in reply to my question, you said, it is a chronic complaint of those landlords that they are not able to make enough return on their investment. In the meantime, there are also tenants in those units who would have difficulty if the rent was to rise drastically. The Rent Review Advisory Committee has come up with a formula by which we can address the difficulties of those units' landlords and also be sensitive to the tenants living in those units without a drastic increase. That formula will take care of the balance between the landlords and the tenants concerned. Would you tell us what the formula is and how it will work?
Minister.
I thank the member for that question, Mr. Speaker. As you know, I think if you have read the legislation that is being forth, it explains to you the formula. As you know, too, that our new proposal, Mr. Speaker, the Bill 51, addresses many, many issues. And I think what the member has done is recognize the brilliance of that bill, where it has that balance of the brilliance, Mr. Speaker, in which he has clearly identified the concern of the landlord and the concern of the tenant. And I'm telling you how anxious I am. I'd like to remind the honourable member, Mr. Speaker, how anxious I am, and my government is anxious to bring that Bill 51 into place, to show where we will strike that balance.
Supplementary.
Speaker, how can the tenants of Ontario believe that you have their best interest at heart when all they have to do is refer to the brochure you were talking about a minute ago, and they will see that there is no formula protecting them at all. Exactly. And yet you have the nerve to get up in this House last week and say there is a formula. You have the nerve to get up in this House today and to give us a lot of mumbo-jumbo that has nothing to do with the question that was asked. Would you explain to this House now, what is the formula?
Minister.
Mr. Speaker, may I instruct the honourable member that he should read the legislation. He's reading the guide. Mr. Speaker, that was helpful, hopingly that when this was produced, it was hopefully that it would help him to understand the legislation. And I see that if he's taken a shortcut to understand the legislation, I think he should read the legislation, Mr. Speaker. I would like also to tell the honourable member, Mr. Speaker, that their ideas, they were bankrupt. They had no housing policy. They had no format of a relevant guideline. Now what he stands there to do is to criticize. Your honourable member is right over there. To our benefit.
Order. New question. The member for York South.
Speaker, I have a question to the Premier.
Order. Point of privilege. Point of order.
You know, I'm very reluctant, Speaker, to accuse the Minister of misleading the House. Very reluctant. But I have to tell you that this borders on misleading the House.
Order. I must tell the honourable member he's coming very close to unparliamentary language. Very, very close. New question. The member for York South.
There are a lot of borderline cases in the House, Mr. Speaker. I'd like to address a question to the Premier, if I might, Mr. Speaker. At the press conference today, I understand that Dr. Railton has said that he couldn't rule out the closure of ICUs. He said all emergency room closures are grassroots; they're not centrally coordinated. He himself admitted that. The official resolution, which was apparently passed today, and I don't have the advantage of the hotline which the Leader of the Opposition has to the OMA, said the President of the OMA has complete support to escalate sanctions at his discretion. I'd like to ask the Premier, does he not feel that it is time that the government looked hard at the legislative framework ensuring access to necessary services in this province, and said that if the College of Physicians and Surgeons can't and won't and dithers, that at least the Government of Ontario is going to ensure that patients are not held to ransom by this kind of irresponsible action by the OMA and its leadership?
Premier.
I'm sorry, Mr. Speaker, that I have not seen the resolution. I just, as you know, arrived late in the House, and I returned the telephone yesterday, so I wasn't able to find out directly from the horse's mouth what the resolution was. Mr. Speaker, I'm aware of the honourable member's point of view and frustration, should I call them, and I don't mean that in any pejorative way. It's a very difficult situation, as you know, for everyone. My direct response to your question is that I think it would be most injudicious at this moment to start looking at changes in legislation in that particular regard. We're in the middle of a supercharged situation. It's being inflamed, as you know, by a number of people, some for legitimate reasons, some for other reasons. But I think that kind of discussion, frankly, should not take place at the present time. Who knows, everything should be discussed at some point or other, sometime in the future, but I don't think it will solve any of the situations right now, at this moment, today, or tomorrow, or next day. But as I said, everything in this is under our jurisdiction could be discussed at some point in the future.
Supplementary.
Mr. Speaker, the Premier is quoted as saying in the paper, in the Toronto Star yesterday, that in response to a question with respect to legislation, said we're not planning to bring it in, and he asked, what if they don't go back to work? I'd like to ask the Premier, is he seriously suggesting that his government would refuse or fail to take the necessary steps to ensure necessary services for the patients of this province because they're afraid of the power of the OMA? You wouldn't do it to nurses. You wouldn't do it to nurses' aides. You wouldn't do it to anybody working in the public sector. You wouldn't do it to a worker in a nursing home. You wouldn't do it to somebody operating in an operating room who wasn't a doctor. Why is there one rule in this province for the doctors, for the upper middle class group of professionals who are denying access to their services, but who are partners in a healthcare system and who should be partners in a healthcare system? Why is there one rule for those people and a completely different set of rules for everybody else who's ever worked in the healthcare system in the province of Ontario?
Since this discussion with the doctors started almost a year ago, I have been, and the Minister has been asked many, many questions, many of them, in the vast majority, hypothetical. What would you do if? What about in these circumstances? And I and the Minister have resisted all temptations to deal in the hypothetical, because you can see how misquotes or responses to hypothetical questions or speculation about what may or may not happen only inflames an already very tender situation. I'm not surprised at the speech that the honourable member makes. I'm not happy about the discussion that we're in at the present time, the conflict. I think if I would beg to differ with my honourable colleague about courage being shown in this situation. I think the Minister has shown unbelievable courage and judgment.
Hear, hear.
And you see, we are responsible. You know, we don't have the luxury just of standing up and yelling, or we are charged with carriage of this situation, and we bear the responsibility for that, and we take that on our shoulders. But I think that the Minister and the judgments that he has made, and you're perfectly entitled to second-guess any one of them. They're being second-guessed by both parties opposite on both sides of the issue. But ultimately, the judgments are made by a Minister that I think has shown remarkable integrity and judgment and sensitivity in the circumstances, and I can't second-guess him.
New question. The member for Wentworth North.
Mr. Speaker, I have a question for the Minister of Agriculture. Several months ago, the Minister, in a statement to the legislature, indicated some draft proposals for some changes to the Ontario Foodland Guidelines. These proposed changes would have a significant impact on municipal severance policies throughout Ontario, and for the past several weeks, many farm organizations and individuals and communities have contacted me expressing their concerns. And I wonder if the Minister could indicate to the legislature what is the status of these proposals and what efforts his ministry is undertaking to gather the input of those that may be affected by them.
Minister. Order.
Mr. Speaker.
Order. We'll just wait. Minister.
Mr. Speaker, it's obvious that the official opposition do not realize the seriousness of the amount of good agricultural land that we are losing in this province through erosion and through the development uses of this agricultural land. I would have to tell the honourable member who posed the question that after I made the statement in the House, I widely distributed the policy statement to all the municipalities, to all the farm organizations, to other individuals and groups, and I asked that we receive their comments by a certain date. I extended that date to the end of June. So we will look at all the comments that have come to us at the end of June, and we will then be in a position to draft a statement that I will be putting in the House sometime in the fall session.
Order. Time for all questions has expired.